Members present, I declare the motion as amended passed.
Members' motion with no legislative effect. Ms. Lam So-wai will move a motion on reviewing Hong Kong's mental health policy. There are 3 members who will move amendments to the motion. This council will proceed to a joint debate on the motion and the amendments. Later, I will first call upon Ms. Lam So-wai to speak and move the motion. I will then call upon Ms. Lillian, KWOK, Mr. Pui-leung, and Dr. Simon Lee to speak in sequence, but they may not move the amendments at this stage. The joint debate now begins. Members who wish to speak, please press the request to speak button. I now call upon Ms. Lam So-wai to speak and move the motion. President, I move the motion as printed on the agenda be passed. We have the pandemic in the past few years, and we have a slow path for recovery. The people of Hong Kong are faced with many difficulties and tremendous pressure, and the Diamond Hill stabbing has happened 1 year ago. The tragedies often would attract much stigma from the public. But now we can see that the waiting time for new psychiatric SOP special outpatient services now reach 99 weeks. We have the National Healthy China initiative. One of the initiatives would be to improve mental health of the nation. So I move this motion to collect the valuable views of members so as to improve our policies. We need a review of the mental health policy in Hong Kong because there is a long waiting time for specialist outpatient services. Right now, there is a triage system in place to accord priority to patients according to their conditions. But then new cases have a long waiting time. For new stable cases, they have to wait for 2 years. Their condition may worsen during their wait, and in turn it will cause an even heavier burden on the public healthcare system. We need to provide more resources to the public healthcare system. We need to minimize the wastage of the system. We need to try to minimize and shorten the waiting time. I'm glad that the hospital authority has implemented public-private partnership program, but according to media reports, only 52 people participated in this scheme last year. But we have 967,000 visitors for the specialist outpatient services. We need a timely review to make sure there is proper allocation of resources. The government may not need to provide full subsidies for patients. We can provide subsidies on a matching basis, so the government can pay a part of the cost, and the patient can pay $200 to $300 to seek private treatment. It provides an additional option to patients so that they do not have to wait 99 weeks. Nor do they have to pay the very high cost of private services. So for the long-acting injections for psychosis, there may be various side effects. And we can see that, in fact, injections may work better. People stop taking oral medication for various side effects, and often they would experience relapse. If we have patients undertake long-acting injections instead, that will lower the chance of them relapsing. But according to a study, we only have 60% of patients making use of long-acting injections. In fact, injections have often been stigmatized. They would say that they would just make people numb. This is not true. We need to promote to people the benefits of injections and provide them with scientific evidence on the effects of injections. Subsidies should also be provided to patients to go to private clinics to get injections if necessary. I also talk about TMS technology, that is a non-invasive brain stimulation therapy that can be of help. Many patients would go to psychiatrists asking about TMS. However, the cost is so high, it is prohibitive for most families. They can only give up on the option. So we have a cure, but people can't afford it. We also have TMS equipment in public hospitals, but the usage rate is very low. We should have the utilization rate of such equipment in public hospitals increase. We have to also cater for different age groups of psychiatric patients. Also, they may have different needs at different stages. For persons in mental recovery, if they have to integrate into community, they rely on the support of their families, and then their carers may face great pressure. I'm glad that the government now has various initiatives to support carers, but we have to ensure such carers are aware of the needs of persons in mental recovery. We can perhaps also have care teams support these carers, but we need to provide training to them as well. We may talk about different treatment options, but prevention is better than cure. We have to make sure we have promotion and public education initiatives for mental health. We have the Shall We Talk campaign, for example. But we need strategic planning for the relevant public education initiatives in order to enhance awareness of the patients and have them seek help early on. In fact, mental health policy would be under the purview of different departments. The Health Bureau isn't the only bureau responsible for this. We should have cross-departmental collaboration. We also need high-level coordination to make sure there is proper policy support for mental health patients. Thank you.
I put the question to you that the motion moved by Ms. Lam So-wai be passed. Ms. Lillian KWOK. Thank you, President. I thank Ms. Lam So-wai for moving the motion on reviewing Hong Kong's mental health policy. Mental health is essential to us. According to Hospital Authority, 1 out of 7 local people have suffered from common mental disorders. Over 300,000 people have been suffering from mental disorders such as depression. We have established a helpline and we have received 237 referral cases over a short period of time. There were carers who committed suicide and there were tragedies happening because of that. Currently, the psychiatry of Hospital Authority is losing its balance. Approximately 100 psychiatrists have to take care of 10,000 patients. So we have to review the Hong Kong's mental health policy. The Hospital Authority have rolled out a community mental health services that is a 3-tiered service model, including standard CPS, PCP, and ICT to identify patients in need. And we also have a medical social workers as case managers to follow up. If average members of the public find out that they have certain mental disorders, they will be referred to hospitals so that psychiatrists and psychologists will assess them and they will make use of a professional intervention. So people are jumping from 1st tier to 3rd tier directly. And we have to introduce a 2nd tier service. And we have some kind of a lacuna in the model. So I think that we should improve the three-tiered service model so that it can go from top down and bottom up. According to different figures, 80 to 90% of the cases can be handled at the first tier without having to be referred to the third tier. For semi-urgent and stable cases, we can introduce counseling and group therapies. For example, we can make use of art therapy, music therapy, family therapy, counseling profession to improve the second-tier support to alleviate the manpower burden of the psychiatry department. So I think that we should improve the three-tiered service model and consolidate the second tier. On the 8th of February last year, we passed the motion on professionalizing the counseling profession in Hong Kong. 7 universities in Hong Kong have established bachelor degree programs on counselors, and we have 7,000 graduates over the years. And I think that we should recognize the qualifications of professional counselors so that patients and people in need can receive appropriate treatments and help. Apart from this, different places and countries have incorporated mental health as part of their primary health care. We have a community or district health care and center, and they focus on identification of chronic illnesses and risk. The centers actually focus on occupational or physical therapy. I think that we should also provide assessment on mental health and as well as counseling service. That is why I proposed in my amendments that we should create this position of a professional counselor so that we can offer mental health services to people in need to alleviate or shorten the waiting time for a psychiatric SOP. In 2012, the country passed the Mental Health Law of the People's Republic of China, which covers strengthening the psychological health promotion and mental disorder prevention, as well as improving the level of psychological health of the public. Earlier on, I worked together with a voluntary group to offer art therapy to people. And I went to the Children's Hospital to look at the possibilities of offering art therapy to children. So I think that when the government is formulating mental health policy, they should consider such options. I so speak in support of the original motion, and I hope that members would support my amendments. Mr. Pui-leung. Thank you, President. Last year, I said that we should improve the mental health of adolescents and children. I wanted to draw people's attention to mental health of young people. We have had a series of tragedies relating to mental health of people, so I think that while I will support Ms. LAM So-wai's motion, I think that we should discuss this issue of mental health of our people. According to recent surveys, it seems that the mental health of Hong Kong people are not ideal, and the government has engaged the KWOK to conduct a 4-year survey on adolescents and children's mental health. Results show that 24.4% of the interviewees are troubled by at least one mental disorders. Some 50% suffer from more than 2 mental disorders. 9% have thoughts of a suicide, and some of them acted upon the thought. For secondary school students, the percentage went even as high as 50%. Some carers may discover symptoms of mental illness, but they didn't want to seek help. They thought that the problem was not as serious, and they were afraid of being stigmatized or labeled. President, I think that this research and surveys is an alarming bell, and I think that the government should work on intervention, identification, and treatment, as well as prevention. And with the lack of support and awareness of the members of the public, most patients go directly to the hospitals, that is the third tier of support. I think that before intervention and treatment, we should work on public education. The government plan to launch this pilot scheme at 3 different district health centers to provide assessment to people in terms of their mental health. I hope that the government will announce details as soon as possible. I think that the DHC should refer urgent cases first, and then they should support stable cases. And I think we also can perhaps train care teams to uncover hidden cases in the community. And also, we should enhance collaboration with the integrated community centers for mental wellness. President, we should enhance public education and public's awareness on mental health. These are our missions. The community has a negative impression on mental illness, and they tie violence with mental illness. Well, actually, less than 5% of mental illness patients actually resorted to violence. So I think that we should review Hong Kong's mental health policy, and I think that we should train the members of the public, and we should launch publicity campaign so that patients will seek help, so that we can prevent, intervene, and treat. Also, we have to increase manpower in the psychiatric department in the hospital authority. The ratio of the psychiatrists to patients is as high as 1 to 760. We don't have enough manpower to cater to the needs of the community. I know that training takes time. I think that we can learn from other cities and countries to train local practitioners. Through intervention, prevention, and treatment, we can alleviate the manpower burden, and we can shorten the waiting time for new cases so that we can focus our resources on handling semi-urgent cases. The government said that they will look into the development of a mental health blueprint. I think that we can only reduce the cost and enhance the effectiveness of treatment if we minimize stigmatization of mental health patients. I speak in support of the original motion and the amendments. Mr. Hoey Lee. President, I thank Ms. Lam So-wai for moving the motion. We've been talking about this subject for a long time, but it seems that it's very difficult for us to come up with a comprehensive policy. The 2 amendments moved are about treatment, and they talked about support to primary or grassroots people. My focus is on children. I think that we should provide daytime child minding services for children with mental health problems, and also we should support primary carers of these families. On the 10th of October, it was the World Mental Health Day. We should safeguard the future for children, and it draws on people's awareness on the mental health problems of children and adolescents. We have to fulfill a certain standards for children to be called as children with good mental health. They have to have an emotional balance. They should be adaptive, and so on and so forth. Children suffer from emotional disturbances, and they have problems with internet usage as well as schoolwork. They suffer from depressions, anxiety, paranoia. Most of them actually suffer from depression. Some children became unusually excited when they are troubled. They don't sleep at night, and they don't wake up in the morning. Some children feel anxious and irritable, and they feel depressed, and they lose interest in study. They cannot concentrate, and they don't want to leave homes, and they don't want to interact with others. Some children and young people even resorted to suicide. I think that we should start from the source and step up prevention of mental health problems. We should consolidate different resources and enhance filtering and screening for mental health problems and reduce stigmatization of mental illness. And also we should provide multidimensional support to children suffering from mental health problems. These problems themselves are complicated. The care and treatment for these children are even more complicated. So this poses actually immense burden on primary carers of these families. Without adequate community support, it will undermine the balance of our community. I think that we should provide daytime child minding service so that carers can adjust themselves and that the children can be treated. I think that we should teach primary carers about the skills to take care of children with mental health problems. We don't see much daytime child minding service for children with mental health problems, but actually such service are beneficial to both carers and those children. I hope that the government will incorporate daytime child minding services into their policy. I so speak in support of the motion and the amendments. Thank you.
醫務衛生局局長。
Secretary for Health. President, I thank Ms. Hon Lam for moving this motion and Ms. Lillian KWOK, Mr. Pui-leung, and Dr. Hoey for their amendments. They have expressed concerns and made suggestions on Hong Kong's mental health policy. The government attaches great importance to the mental health of the public. Comprehensive mental health involves various aspects, including medical care. Therefore, the government adopts an integrated approach to promote mental health through cross-sectoral and interdisciplinary collaboration, as the policy involves the responsibilities of different bureaus and departments. Through coordination and collaboration among the Education Bureau, Department of Health, the Health Bureau, Hospital Authority, Labour and Welfare Bureau, Social Welfare Department, and NGOs and other community stakeholders, the government takes an integrated approach to provide interdisciplinary services for persons with mental health needs. These include prevention, early identification, timely intervention, treatment and rehabilitation, self-care, as well as community support. The government published the Mental Health Review Report in 2017, which contains recommendations on enhancing the overall mental health services. To monitor the implementation of these recommendations, the government set up the Advisory Committee on Mental Health, or ACMH, in December 2017, comprising members from the healthcare, social service and education sectors, as well as lay members who are concerned about mental health. The ACMH provides a platform for close collaboration among members, stakeholders, NGOs, the government, the relevant policy bureaus and departments. It assists the government in formulating policies, strategies, and measures to enhance mental health services on all fronts. Apart from timely intervention, treatment, and rehabilitation services for those in need, we also need community support. That is why we need a multidisciplinary team bringing together social workers, teachers, trained non-medical professionals, including the counseling professionals Ms. Lillian KWOK mentioned, as well as medical professionals, each with their respective roles to play in order to provide comprehensive mental health services to the general public, persons in mental recovery, and their carers. Relevant government departments and policy bureaus have been promoting the mental health services at the community and primary care levels through medical social collaboration and a tiered service model. We will continue to explore ways to enhance the role of non-medical professionals, including counselors, in the multidisciplinary mental health service teams. In response to public demand and stakeholders' suggestions, the government has rolled out various community-based mental health services for the public in recent years, and I will give you a few examples in the following. On support for persons with mental health needs and their carers, the Social Welfare Department operates 24 integrated community centers for mental wellness, or ICCMWs, through subventions to NGOs to provide one-stop district-based community mental health support services ranging from early prevention to risk management. The Social Welfare Department also provides subventions to an NGO to operate a Parents Relatives Resource Center to support carers for persons in mental recovery. In view of student suicide cases, the government has collaborated across different departments. The Health Bureau, the Education Bureau, and the Social Welfare Department rolled out the 3-tier school-based emergency mechanism in December 2023 to provide early support to students at risk. In addition, the government also provides prevention, early identification, and appropriate intervention services. In the end of 2023, the government launched the 18111 mental health support hotline, as well as an ethnic minorities service center to provide emotional support and counseling services respectively. The 18111 mental health support hotline provides one-stop round-the-clock support for people with mental health needs, rendering immediate mental health support and referral services depending on the nature of the cases. As for the Ethnic Minorities Service Center to provide emotional support and counseling, these services are provided in EM languages, and if necessary, cases are referred to other service platforms for additional support or treatment. As announced in the 2023 policy address, the government will launch a pilot scheme in 3 district health centers within this year in collaboration with community organizations to provide mental health assessments for the public and to provide early follow-up and referral for high-risk cases. We expect the pilot scheme to come into operation in the 3rd quarter this year. Under the pilot scheme, counselors will provide counseling interventions to cases of mild to moderate mental illness identified through mental health assessment screening. The government will also provide mental health support training to care teams, including mental health first aid training, to facilitate early referral of those in the community in need of support. Ms. Hon Lam's motion refers to psychiatric services in public hospitals. The hospital authorities' multidisciplinary psychiatric teams comprising doctors, nurses, clinical psychologists, occupational therapists, medical social workers, and peer workers have been providing comprehensive and continuous medical services to those with mental health problems, including inpatient, outpatient, specialist, outpatient, day rehabilitation training, and community support services, depending on their medical conditions and needs, and I will go through them very briefly. In order to ensure that patients with urgent medical conditions are treated within a reasonable time frame, the HA's psychiatric specialist outpatient clinics adopts a new triage system. Newly referred cases are classified into Priority 1 urgent, Priority 2 semi-urgent, and general stable categories. In general, patients with urgent medical needs, such as those with a high propensity to violence or strong suicidal risk, will be triaged as Priority 1 or urgent cases to ensure prompt treatment. Last year, HA achieved the target median waiting time, that is, not more than 1 week for Priority 1 urgent cases and within 4 weeks for Priority 2 cases. In addition, HA's psychiatric nurse clinic services allow patients to receive follow-up care during the waiting period for specialist outpatient clinics or follow-up visits. Ms. Lam's motion also refers to support for persons in mental recovery. The government understands that some cases involving persons in mental recovery have caused widespread concern in the community. To enhance support for persons in mental recovery and alleviate the workload of HA's psychiatric department, HA has, since the middle of 2022, introduced a co-care service model under the GOPC Public-Private Partnership Program. Patients who have been receiving HA's psychiatric treatment for 12 months or more for general mental illnesses, such as anxiety, depression, adjustment disorder, and who are diagnosed as suitable for receiving primary healthcare services in the community, are invited to join the program. This can shorten the waiting time for HA's psychiatric specialist services and more effectively allocate resources to deal with more complex mental health cases. However, not all persons in mental recovery are suitable for follow-up in the form of public-private collaboration. The severity of the patient's condition, the required medication, and the support services will all affect whether the individual is suitable for this model. Since individuals with severe mental illnesses require more comprehensive medical support and resources for follow-up, those recovering from severe mental illness are more suitable to continue their recovery journey in the public healthcare system. Through medical-social collaboration, we can ensure that they follow the set goals and recovery plan as they embark on the journey of recovery in the community. In relation to community psychiatric services, in recent years, HA has actively rolled out various schemes to enhance community psychiatric services. Together with community partners and carers, HA supports persons in mental recovery in the community. Community psychiatric services cover 3 levels, including the intensive care team, case management program, as well as standard community psychiatric service, taking into account patients' medical conditions as well as clinical needs and risks. The multidisciplinary teams provide them with appropriate community support such as mental health assessment, symptom management or disease management, relapse prevention, medication management, crisis intervention, stress management, physical health care, and psychoeducation. Through regular outreach and home visits, as well as close collaboration with community partners, case managers help persons in mental recovery set goals and draw up recovery plans to facilitate their reintegration into the community. Support and advice are offered to the carers and families while endeavoring to promote mental health in the community. HA earlier already optimized the ratio of case manager to patients with severe mental illness to no higher than 1 to 40. President, the government understands the public's concern on psychiatric services. As I said in my opening, the government's psychiatric services involve the responsibilities of different policy bureaus and departments. The government also needs to work with different NGOs and community stakeholders to meet the evolving mental health needs of the community. The government will continue to explore ways to enhance mental health in Hong Kong in an integrated, safe, and comprehensive manner so as to provide interdisciplinary, intact, and continuous mental health services through public healthcare institutions to those in need. President, I'll be happy to give a response after listening to members' views. Thank you.
梁永傑議員。
Mr. Yan Wen-kit. Thank you, Deputy President. I support the motion. Before, we do not have any long-term mental health policy. And last year we had the Diamond Hill stabbings. We had also multiple tragedies after that. The government proposed thereafter 10 measures to support persons in mental recovery. But these only relate to the treatment of psychiatric patients. It does not tackle the root cause of the problem. The government must have the relevant data in order to formulate the policies. In fact, for the every 5-year demographic survey, we can gather more data with the census, and then we can formulate more policies. And in fact, for the annual student health service survey, students do not really complete accurately the questionnaires. Thus, the questionnaires are unable to reflect the true situation. So I ask frontline officers to supervise the students filling in of such questionnaires. And we can then make use of the correct data in the questionnaires to make referrals if necessary. The problem with mental health policies in Hong Kong, we have a great shortage. The WHO has a standard for 1 in 10,000 people so 1 psychiatrist per 10,000 people. So we need at least 700 psychiatrists. We have a long waiting time of 2 years for new stable cases. And every time, patients may only get to see the psychiatrist for a very short period of time, perhaps just several minutes. So I ask the government to think about proper introduction of non-locally trained psychiatrists. We need to also increase the number of training places for psychiatrists to ensure there is adequate manpower. We also need to make sure there are clinical social workers, and we need to make sure there is proper support for psychiatric patients. We can perhaps also make use of technology such as AI for the diagnosis of psychiatric treatments. In Taiwan, they have a diagnostic system making use of the patient's brain waves to make diagnostics. Rather than relying on only clinical signs, we can rely on brain waves and thus instilling more trust in doctors of patients. We can also make use of a platform that makes use of AI to conduct more exchanges with patients, and we can gather more physical and mental data of patients, and the data can then be transferred to the attending doctor for them to make a better judgment and diagnosis. In fact, studies have shown that we can make use of telehealth services in psychiatric treatments. The Eastern District Hospital has already regularized relevant arrangements, and we can refer to the example to implement telehealth services for psychiatric patients. And this should alleviate the burden on the public healthcare system, thus facilitating early intervention. We also need to enhance awareness for the families and carers to identify the symptoms. We also need to enhance awareness of patients in relation to drug compliance. In fact, a lot of the patients do not comply with the drug requirements, and thus causing them to have clashes with neighbors. So we should have the long-acting injections included in the relevant schemes so that more patients will take advantage of that. We also want to prevent any future tragedies from happening. So I speak in support of the motion as well as the amendments. Thank you, Reverend Peter Kuhn. The mental health situation of Hong Kong has been of concern in recent years. We have seen an increase of number of students who have mental health disorders. We have also seen an increase in the number of student suicides. It is a 5-year high, in fact, from the figures of last year, we have received the questionnaires submitted by students, and they have said that in the past year, for those who have attempted suicides or had suicidal thoughts, would be 2.8 and 1.3 respectively. I think we are at a breaking point here. We need to think about what difficulties youngsters face, and then they are so desperate that they would turn to suicide. We have the 3-tiered emergency mechanism that would help identify students with suicidal risks, but we do not know about the effectiveness of such mechanism as of yet. And it is only when students have already had such thoughts that we are intervening. And I think we are not supporting students enough with this. We need to tell students how good life can be. In view of the situation getting worse, we should tackle the root causes of the issue. In order to improve the mental health of students, we need to adopt a multi-pronged approach. We need to go through family members, teachers, and schools to provide more comprehensive support for students. We need to intervene early to tackle the emotional issues of students. Family members are very important in this. In order to make sure children can live happily, education of parents is very important in this. The role that parents play would be very important for the formation of the youngsters. So apart from gauging the gatekeeper scheme for parents, we also need to ensure there is proper parent education, telling parents how to effectively communicate with children and to tell them about the importance of listening to their children. We also want to ensure parents would adopt a positive attitude when dealing with problems relating to their children. The government should also subsidize schools to hold more parenting skills related activities. Right now, the Department of Health has a student health service, but then the attendance of the relevant seminars and activities is quite low. So if students, rather than having them voluntarily participate in such service, we can have schools arrange students to go to district health centers to increase the participation rate. We should also deploy more resources to promote collaboration between families and schools, to have support groups set up, for example, and to intervene early to resolve the emotional issues faced by students. Apart from enhancing awareness of teachers by providing training to them, I would say teachers should be provided with more flexibility to communicate with students. This will build mutual trust between teachers and students, and teachers can provide counseling if necessary. I so submit speaking in support of the motion and amendments. Mr. Edward Leung. Thank you. I speak in support of the motion and the amendment proposed by Ms. Lillian KWOK. I have all along been concerned about the issue. In fact, I moved a motion before in relation to the shortening of the waiting time for SOP services. Psychiatric SOP services have a very long waiting time, and we have a chronic manpower shortage. In the last few years, regarding the figures relating to mental health, the mental health index for the last 5 years fell below the passing grade 15% and 12% of the people have anxiety disorder and depression, respectively. So for those affected by mental health disorders, if they are to wait for 99 weeks before they can see a doctor, their conditions can get worse during the period. So whether it's the patients or family members, they will all be affected. I urge the administration to do something about this to prevent any future tragedies from happening. We will also talk about healthcare manpower. Recently, the latest report has shown that the shortage can only be addressed the earliest in 2030. So the next few years will be key. So regarding the amendment proposed by a member of my party, we need to make sure their mental health support measures are included in primary health care. And facilitating early intervention is very important. If we can resolve the emotional issues of students early on, we can prevent that from ballooning into an actual disorder. And we have a Buddhist saying that if you look at things differently, the situation may be completely different. So I think it is very important to resolve any concerns early on. After the tragedies that happened last year, the government has proposed 10 measures to improve on the mental health care support measures. And in the policy address, it was said that a pilot scheme would be launched in 3 district health centers to provide support to persons in mental recovery as well as carers. But I do not hear any updates since the policy address. I asked the administration to talk about the progress as well as a timetable for the initiatives to be implemented. There are some assessment tools available online for physical indicators for diabetes and for someone to check whether they are overweight. For anxiety and depression, there are also some preliminary assessment tools available. Will the government upload such tools onto your website so that citizens can test themselves if necessary, or even conduct assessments for their family members? Of course, we should not trust only the assessment tools, but these can act as a reference to identify those who need such services early on. When we talk about the WHO standard for psychiatric doctors, we are lagging behind. I hope the government will address this problem as soon as possible so as to ensure Hong Kong's mental health index will achieve a passing grade or even a satisfactory grade. I so submit, Deputy President.
主席，
Mr. Dennis Lam, Deputy President, I speak in support of the motion and all the amendments. Last year, on 19th of June 2023, a special meeting was held by the Panel on Health Services to discuss treatment and support services for those with mental illness and those in mental recovery. According to this paper, the government would propose 10 measures on the recommendations of the ACMH Advisory Committee on Mental Health to better support persons in mental recovery. In the Chief Executive's 2023 Policy Address, paragraph 145, the government gives a response to this matter. An integrated approach would be taken to take forward prevention, early identification, timely intervention, treatment, and rehabilitation services for those with mental health needs. The government is committed to helping these people as well as their family members so that early support can be provided. According to the World Health Organization, health is not just about not having any illness or disease. It is also about having a good mental state. Now, there are lots of misconceptions about mental illness around the world. There is also negligence involved. According to figures in 2019, 61% of Hong Kong people suffered some sort of mental health problems. That is 1 out of every 7 Hong Kong people experience mental health problems in their life. And in 2014, we recorded the number of people with mental health problems, and the figure doubled that in 2004, and 74% of these people did not seek medical help. Now, does it affect their work performance? And because of poor sleep, emotional imbalance, there would be clashes with their superiors, as well as a negative culture in the work environment. Now, if we take a look at the figures, Hong Kong people work for the longest hours. On average, they work 51.1 hours per week. Close to 40% of Hong Kong people worked overtime for up to 4 to 8 hours a week. And in 2018, 46% of Hong Kong people worked for over 50 hours a week. And every year, employees in Hong Kong lost close to 77.4 days of productivity. In 2020, out of the 50 regions which participated in a survey, Hong Kong ranked 45th place. And Hong Kong people tops the chart when it comes to overwork. And also, the global average is 2.5 people suffering from anxiety or depression, but we exceed that level. So as a member of the labor sector, I urge the government to follow up on the standard working hours arrangement so that 3.8 million employees in Hong Kong can enjoy good physical and mental health. In order to make Hong Kong people healthier, we need to regulate working hours. There should be standard working hours, and a mechanism should be set up for overtime pay. And another review report on mental health should be published as soon as possible so as to map out the mental health policies for the future. We also need to have regard to the ratio proposed by the World Health Organization. There should be at least 800 psychiatrists in Hong Kong. At the moment, inpatient psychiatric services are provided only by public hospitals. This may be a deterrent for those who would like to seek help. The government should make sure that private hospitals offer psychiatric inpatient services to help address the needs. Now, in terms of treatment for adolescents and children with mental health needs, we should make sure that there is timely and early intervention and treatment for our next generation. My sixth suggestion is that Hong Kong, the government should ramp up promotion and publicity so that every Hong Kong people knows about the importance of mental well-being. I so submit. Mr. Duncan Chiu. President, I need to declare that I'm a member of the Hospital Authority. I'm also chair of the Governance Committee of Pui-leung and Princess Margaret Hospitals. I thank the member for moving this motion. Mental health is now a very hot topic all over the world. The government attaches importance to mental health as well. In 2017, the review report on mental health was published. It put forward over 40 recommendations, and the Advisory Committee on Mental Health was set up to follow up on the implementation of the recommendations in the review report. However, as mentioned by other members, we continue to see tragedies happening one after another. This poses a great challenge to us. Now, additional resources should be provided to public hospitals for to ramp up inpatient psychiatric services. There should be more psychiatrists and psychiatric nurses to shorten the waiting time. This sounds simple, but it's more than that. Secretary just shared with us some examples, such as the triage model they've recently adopted. But the crux of the problem is a shortage of psychiatrists. It will take some time for the additional resources to take effect. According to information, every year, there are 370 psychiatrists working for public hospitals. In 2023, there were 381, comparing to 351 psychiatrists in 2018. That's been an increase by 8.5% or 30 more psychiatrists. However, in terms of patients, the number has increased from 261,800 in 2018-19 to some 96,900 in 2023, and that's a 3.4% jump, or 35,100 more patients. That's 8,700 more per year. So the ratio has jumped from 1 to 746 to 1 to 779. According to the WHO's recommended ratio, it is projected that we will need 750 psychiatrists in Hong Kong for the 7.5 million population. Now we are short of psychiatrists. We need to catch up. Now, in Pui-leung Hospital, we have 80 psychiatrists, and there were over 240,000 attendances last year. It is very urgent that more psychiatrists be provided. Ms. Hon Lam also raised certain issues in her motion, such as public-private partnership programs. In Pui-leung Hospital, for example, I know that the government has been taking forward the PPP model, and it has achieved some result. But psychiatry is a very unique specialty. A patient usually is attached to a doctor, and it's very difficult to change doctors all the time. What about introducing doctors from outside Hong Kong? Psychiatry relies very much on communication, and language is key. It is not a solution. In order to address the surge of psychiatric cases, I have the following suggestions. At the community level, more practitioners should join the primary care model, who are familiar with handling these cases, such as medical social workers, and also the participation of community organizations to properly handle persons with mental health needs. Different organizations can help handle these cases at different levels. We should also ramp up the role of the ICCMWs. They should have a bigger role to play. They should work with NGOs and train more case managers in the community to help deal with mild cases and help intervene at an early stage so as to help patients or divert patients from the hospital system. I support the motion and the amendments. Mr. Robert Lee. Thank you, President. I speak in support of the motion moved by Ms. Hon Lam, which is a debate on reviewing Hong Kong's mental health policy. There are over 300,000 patients with mental health needs, covering 4% of our population. This is something we must not turn a blind eye to. There is a need for the government to review Hong Kong's mental health policy. I'm going to talk about the mental health services at different levels, increase in mental health manpower, as well as tapping the market forces. At different stages of our lives, we may have different mental health problems. I came across an elderly lady. This lady is well taken care of by her husband. But after the husband passes away, this elderly lady start to have suicidal thoughts because of lack of self-care. And then I was also told by a student once that the student would want to jump off the school building. So we should not consider suicide cases just by looking at the numbers. There are stories behind these cases. We should show more care for these cases. The SAR government should target different age groups with mental health needs and draw up different policies. Now, in relation to mental health problems among youths, in December last year, the government introduced a 3-tier service model. This mechanism has begun to yield results. On this basis, the government should regularize the mechanism and further extend the mechanism to primary schools. There are also measures drawn up, groups formed to help bereaved spouses, elderly people, and carers of elderly. The care teams should pay regular home visits and provide counseling to these people. I also support the suggestion of enhancing mental health support services in primary health care and enhance public awareness of mental health, as mentioned by Mr. Pui-leung in his amendment. We should encourage those in need to seek help. Last year, the government set a target median waiting time for psychiatric specialist services. For urgent and semi-urgent cases, the government has met the target median waiting time, and yet we're still short of psychiatrists. The wastage rate for psychiatrists reached 6.4%. Psychiatric nurses, this figure now stands at 8.3%. It's a record high. We need to increase manpower. We also need to put in additional resources to tackle the high attrition rate so as to retain talents. The OECD has pointed out that mental health problems could pose a very heavy burden on our society. This could cause a loss of 4% of our GDP. The government should encourage the private sector to formulate policies to look after the mental well-being of the employees, so as to enhance the efficiency and the productivity in the workplace. For senior employees who are senior in age, resources should be provided to help tackle the problem of loneliness and the psychological problems stemming from it. More resources should be provided to prevent mental health problems. Not only would it help those with mental health needs, it would also bring social benefits. This can also help enhance people's sense of happiness. So it's a form of investment. As for the original motion and other amendments, I am in support of all these ideas. I hope that the government will continue to improve mental health services and roll out more preventive measures.
Hong, President, the World Health Organization said that without mental health, there's no health. Mental health does not only affect personal development, family harmony, and development of our economy. All these are affected by people's mental health. That is why we have to review Hong Kong's mental health policy from time to time. The motion moved by Ms. Hon Lam and other amendments are about the government's review of the Hong Kong's mental health hospital, the dedication of resources to the public sector, and also more resources should be dedicated to public-private partnership. We should encourage patients to seek help from the private sector, and we should incorporate mental health support services into the primary health care blueprint. All these ideas are to shorten the waiting time for psychiatric SOP in the public hospital so that patients can seek help and receive treatment from doctors. In 2017, the government promulgated the Mental Health Review Report. They announced 40-odd enhancement measures ranging from support services to schools and the medical sector as well as people in need. Currently, the psychiatric SOPs and the 42 ICCMWs offer relevant services. I think that the recent tragedies that involve people in mental recovery happen because people are afraid to seek help, and there is lack of support for people in mental recovery when they have a return to the community. I think that there should be seamless transition for patients being discharged from hospital. They should be able to receive continuous support in the community. Also, we should enhance the role of the case managers of the ICCMWs so that patients after discharge can receive continuous care. Also, the high cost of mental services in the private sector drive patients away from the private sector to the public hospitals. So I think that with the support of private healthcare organizations, we can shorten the waiting time for public hospitals. According to the government statistics for patients suffering from PTSD, depressions, and other disorders will affect their emotions. They can improve their conditions and situations after intervention and drugs. For serious mental illnesses, including psychosis, as long as these patients receive treatment, they can have their conditions stabilized. President, I think that we should enhance public awareness on mental health. We should encourage them to receive assessment so that we can cater to the needs of patients suffering from serious illnesses. As for patients suffering from mild and semi-serious illnesses, we should make use of, for example, DHCs and care teams, as well as district pharmacies, counselors, and other professionals, so that they provide referral services and counseling to these patients. We also attach importance to whether the patients after discharge will have the support of the case manager of ICCMWs and medical social workers. We're also concerned about the process of referrals so that we don't miss any patients out. Also, we need experienced case managers to formulate a treatment plan. The ratio of case managers to patients have been improved, but actually after the pandemic, there is a manpower crunch in the social welfare sector as well as the healthcare sector that pose difficulties. I think that the government should dedicate more resources and also enhance collaboration between the private and public healthcare sectors, as well as to enhance assessment of mental health in the community. Also, we should cater to the demand of drugs among mental health patients, lower the cost of mental health services, and formulate a long-term plan for the improvement of mental wellness among people. I still speak in support of the original motions and amendments. Professor William Wong. President, since 2013, we established this advisory committee on mental health. And after that, we have achieved some great results in terms of mental health. We have this mental health at HK program. And we also have this dementia community support scheme. All these will increase the coverage of mental assessment in Hong Kong and provide more detailed support to people in need. At the same time, the government rolled out this case management program. This will offer comprehensive support to patients. Also, through multidisciplinary collaboration or program, this will enhance the service quality offered to mental illness patients. According to statistics in 2022, our mental health index stands at some 47.64. This is far lower than the WHO index of 52 points, which is the passing mark. This index shows the mental health and mental well-being of our people, and it also shows us that we have to further improve our mental health policy. For this reason, I think that the government should make use of artificial intelligence to solve our problems. Take Singapore as an example. They have introduced AI to make diagnosis. They have OPSIS system. This is an AI emotional software. It can analyze people's reaction and facial expressions via teleconferencing so that they can uncover mental illness problems among people. The CHA also developed a mobile application to detect depression of users. They analyze the voice and the speech of the users in order to make such diagnosis. And they also collect habits of the users via the app. The accuracy is as high as 80%. Making use of AI technology will allow the medical doctors to have a more comprehensive understanding of the patient's conditions so that they can recover faster. The government attaches importance to mental health problems, and they will lower the ratio of case manager to patient. There are scholars who pointed out that most case managers are social workers. They lack adequate medical training. They cannot cater to the medical needs of patients with serious to semi-serious illnesses. I think that we should learn from the mainland. They have developed a platform. This Emo GPT provide 24-hour service to the users to make up for the lack of resources in the community. Through analysis of big data, Emo GPT can provide a tailor-made and personalized service to users to enhance its accuracy and quality. Of course, Emo GPT cannot completely replace professionals, but it serves as a stopgap measure to offer support to mental patients. I think with the support of the government, coupled with the application of IT, we can better meet the challenges of mental health problems in the community. I so speak in support of the original motion and the amendments. Mr. Chan Kim-por. Thank you, President. In recent years, there have been a number of tragedies involving mental health patients, including the one in Diamond Hill. The government rolled out 10 enhancement measures to support patients. But with inadequate resources, there is still lack of support. With this ticket times one, I think that we have to increase the number of medical doctors and social workers. And also, we should allow for patients to receive antipsychotic depot injections. And also, we should learn from the mainland to formulate this centralized drug procurement system. Since mid last year, we have some 290,000 mental patients in Hong Kong, but we only have 380 psychiatrists in Hong Kong. For extreme cases, they have to wait some 97 weeks. But mental patients often relapse, and they have to wait 99 weeks to see a doctor. And I think that this situation is not ideal. So I think that the government should increase manpower in the public sector and, if appropriate, introduce non-locally trained psychiatrists. The government will be lowering the ratio of case manager to patients. The case manager will not handle more than 40 patients. But according to statistics, the case manager can only handle some 18,000 patients a year. Of course, not all cases need follow-up from the case managers, but actually only 30% of the cases are being followed up on by case managers. I think that we have to increase the number of case managers. The Health Bureau create this mental health support hotline to support people in need. In the first 3 months, we have some 30,000 calls. Some 200 referrals have been made, and some 2 cases have to be intervened by the police. I think that we should reach out to patients in need. For patients who have not seen a doctor for the first time and for those who have not attended follow-up consultations, we should attach importance to that. Also, I should talk about the long-acting antipsychotic injection. If they can receive injections once every 3 months, that can replace drugs. This is very beneficial to patients. Over half of the patients do not follow the doctor's instruction to take medication. And some patients give up on medication after throwing up, so the relapse rate is about 90%. According to the Hong Kong Youth statistics, the injection can lower the suicidal rate by 44%. So the effect is very substantial. But the long-acting injection is very expensive. Only 5,000 people have been prescribed with the injection. Some 1,300 were prescribed the old kind of injection. More and more people are seeking medical help in the mainland. The same type of drug treating cancer, it cost only $60,000 in the mainland, but it costs some $100,000 in Hong Kong. There is great discrepancy in terms of drug price between the mainland and Hong Kong. I think that we should adopt this centralized drug procurement system so that patients can get hold of cheaper drugs. Mental illness is a ticking time bomb, and I think that we should procure long-acting injection to solve the problems. Before establishing this centralized procurement system, I think the government should subsidize stable patients to receive injections in the Shenzhen. Thank you.
We are now suspending the meeting until 9 a.m. tomorrow.